Hello and welcome. I'm Justina Walid, and today we're talking about something that could save your life. The top 7 silent signs of colon cancer you shouldn't ignore. Colon cancer is common but highly treatable if caught early, especially for those over 40. The problem? Early signs are subtle and easy to dismiss. In this video, we'll break down 7 often overlooked symptoms you need to know. My goal: help you recognize these signs and feel confident seeking medical advice. Let's get past the discomfort and focus on the facts, because being informed is your best defense. The first sign to be aware of is persistent changes in your bowel habits. It's important to recognize when something shifts from your normal digestive rhythm. Everyone has an off day, a day where things might not feel quite right. But if you notice a new pattern emerging, a consistent alteration in your bowel movements, whether it's constipation, diarrhea, or even a fluctuating combination of both, and that lasts more than just a few days, perhaps stretching into weeks, it's time to pay close attention. Chronic constipation means experiencing difficulty. This could mean straining significantly more during bowel movements or going significantly less often than you typically do. Conversely, persistent diarrhea manifests as ongoing loose stools, occurring frequently and unexpectedly. Pencil-thin stools, a change in the caliber of your stool, can signal that something is physically narrowing your colon, potentially obstructing the normal flow. Sometimes you might experience a confusing pattern where you swing back and forth between periods of constipation and diarrhea. The key is persistence. It's not just a one-time occurrence. It's about recognizing a clear and sustained change from what is normal and typical for your body. Don't simply chalk it up to getting older or attribute it solely to stress. Lasting changes in your bowel habits are your body's way of signaling that there might be an underlying problem that needs attention. You know your own baseline better than anyone else. If something feels off, if it deviates significantly from your norm and it doesn't resolve on its own, it's time to talk to your doctor and seek professional medical advice. Early action and timely intervention can make all the difference in addressing potential health concerns. Don't ignore a new, ongoing pattern in your bowel habits. It's crucial to acknowledge and address it. Prioritize your digestive health and pay attention to the signals your body is sending you. It's not just a minor nuisance or an inconvenience. It could potentially be a warning sign indicating a more significant underlying issue. Trust your instincts, listen to your body, and don't hesitate to get checked by a healthcare professional. Persistent changes in your bowel habits are never just nothing to be dismissed lightly. Your health is worth having an open and honest conversation with your doctor. Take that first step towards better health. Listen attentively to your body and act accordingly. The second sign, and a very important one to be aware of, is blood in your stool. This is a symptom that should never be ignored, no matter how minor it may seem initially. It's a signal from your body that something needs attention. Bright red blood often indicates bleeding in the lower colon or rectum. This type of bleeding is usually closer to the anus. On the other hand, dark tarry stool suggests bleeding higher up in the digestive tract, such as the stomach or small intestine. This indicates that the blood has been digested. While hemorrhoids are a common cause of blood in the stool and can be quite painful, so can more serious conditions like colon cancer. It's crucial not to assume the cause without proper medical evaluation. Don't guess at the cause of the bleeding. Get checked by a medical professional to determine the underlying issue. Sometimes blood in the stool isn't visible to the naked eye at all. This hidden or occult bleeding can only be detected through specific lab tests performed on a stool sample. That's precisely why regular screenings, including stool tests, are so important for maintaining your health and catching potential problems early. It's easy to rationalize blood as just hemorrhoids or attribute it to something you ate, but making assumptions about the cause of rectal bleeding is risky and could delay necessary treatment. Any new or persistent rectal bleeding, regardless of how minor it seems, absolutely needs a thorough evaluation by a doctor to determine the underlying cause and rule out any serious conditions. Remember, blood belongs circulating in your vessels, not being passed in your stool. Ignoring this symptom is like ignoring a smoke alarm going off in your house. It's a warning sign you shouldn't dismiss. If you see blood in your stool, don't hesitate. Call your doctor's office and schedule an appointment. Let a qualified medical professional conduct the necessary examinations and determine the underlying cause of the bleeding. Don't wait and hope that it will simply go away on its own, as this could allow a serious condition to progress. Early detection and timely intervention are key and can significantly improve outcomes and even save lives. Take immediate action and contact your doctor if you notice this important sign. Third, unexplained weight loss. Losing more than 5% of your body weight in 6 to 12 months without trying is a red flag. Colon cancer can cause this by stealing nutrients and energy, or by reducing your appetite. Chronic inflammation from cancer can also suppress hunger and change how your body uses food. You might notice your clothes fitting looser, or friends commenting on your weight. Don't ignore these changes, especially if you feel more tired or unwell. While other conditions can cause weight loss, cancer must be ruled out. If you're losing weight without trying, see your doctor. It's not just about the number on the scale, it's about your health. Pay attention to subtle changes. Early investigation can make a huge difference. Don't brush off unexplained weight loss. The fourth sign is ongoing abdominal discomfort, cramping, bloating, or a dull ache that doesn't go away. We all get stomach aches, but persistent pain is different. Tumors can cause blockages leading to cramps, gas, and bloating. If you feel full, swollen, or gassy more often than usual and it doesn't resolve, take note. The pain might be vague or in different areas, but the key is that it's new and persistent. Don't self-medicate for weeks, get a proper diagnosis. If you're over 40 and develop new, ongoing abdominal symptoms, cancer should be considered. Don't ignore pain that lingers. Your abdomen shouldn't be a constant source of discomfort. Listen to your body's signals. Seek answers if symptoms persist. The fifth sign is a feeling that your bowel doesn't empty completely after a movement called tenesmus. Even after going, you feel like you still need to go. This can happen if a tumor is pressing on your rectum, tricking your body into thinking there's more to pass. It's not constipation, it's a persistent, nagging urge. You might make frequent, unproductive trips to the bathroom. This symptom is especially linked to cancers in the rectum or lower colon. Don't dismiss it as just being constipated. If this sensation lasts more than a few days, it's a specific warning sign. Pay attention to how you feel after using the bathroom. If the urge lingers, talk to your doctor. It's a clue that shouldn't be ignored. Take this symptom seriously. The sixth sign to be aware of is profound weakness or fatigue. This isn't just feeling a little tired after a long day. It's a persistent and overwhelming exhaustion that doesn't improve with rest, no matter how much you sleep. We all get tired from time to time. That's a normal part of life. But this is a deep, debilitating exhaustion that significantly affects your daily life, making even simple tasks feel monumental. Colon cancer, in some instances, can cause slow, chronic blood loss over an extended period. This ongoing blood loss can lead to iron deficiency and eventually anemia, a condition characterized by a shortage of red blood cells. As a result of anemia, you might feel short of breath, even with minimal activity. You might also experience a general sense of weakness, or find yourself unable to participate in activities and hobbies you used to enjoy because you simply don't have the energy. Cancer itself also drains your energy reserves, acting like a parasite. It does this by consuming vital nutrients that your body needs and by triggering a systemic inflammatory response. Therefore, if you're experiencing fatigue that is significantly more pronounced than usual, and there's no clear or obvious reason for it, it's important to pay close attention to your body. Look specifically for fatigue that is new in onset, persistent over time, and significantly impacts your daily routine and overall quality of life. This is especially crucial if it's accompanied by any of the other symptoms that we've already discussed in previous chapters. Don't simply attribute it to stress, a busy lifestyle, or the natural aging process. Your body could be fighting a hidden battle against an underlying condition that needs attention. If fatigue is consistently holding you back and preventing you from living your life to the fullest, it's essential to get checked by a healthcare professional. Early diagnosis and intervention can dramatically change the course of the disease and improve your overall outcome. Don't ignore persistent and unshakable exhaustion. Listen to your body and seek medical advice when something doesn't feel right. The seventh sign is a new diagnosis of iron deficiency anemia, especially in men or postmenopausal women. Anemia means your blood can't carry enough oxygen, often due to hidden blood loss in the colon. Colon tumors can bleed slowly, causing anemia before any visible symptoms appear. Symptoms include fatigue, weakness, pale skin, or dizziness. Often anemia is found on routine blood work when someone complains of tiredness. If you're diagnosed with iron deficiency anemia and there's no obvious cause, ask your doctor if it could be from your colon. This lab finding is a major clue and should prompt further testing, like a colonoscopy. Don't ignore a new anemia diagnosis. It could be the first sign of colon cancer. Early investigation is critical. We've covered 7 silent signs: persistent bowel changes, blood in stool, unexplained weight loss, ongoing abdominal pain, incomplete evacuation, profound fatigue, and new anemia. These are your body's early warnings. Don't wait for them to get worse. If any of these symptoms sound familiar, schedule a doctor's appointment. Early detection leads to simpler treatments and better outcomes. Don't let embarrassment stop you from seeking help. You are your best advocate. Listen to your body and act. Share this video with loved ones. It could save a life. Stay informed, stay proactive, and be well.